really felt challenged to do something that we hadn't done in a long time in our state, which was to look at get the data. And I think getting the data was really the first thing that, and the most important thing, because you can't really fix something unless you know who and why, and then assemble the stakeholders to then formulate a plan to make a dent and to move the needle on something that is just so important. So we know that African American women have more cardiovascular disease. I think it's pretty obvious that when there's less access to care as part of an inequity, we're more likely to see poorer health entering pregnancy, and I think that plays a role. There's probably a genetic factor.
Well, we're seeing a rise in comparison for our minority moms with maternal fetal mortality and morbidity. Unfortunately, there's just limited access to care, and that is directly impacting both mothers and babies. Not everyone lives near an obstetric provider, unfortunately, so they're not making it to their prenatal appointments, or if they are, they're coming late. Lack of resources is another thing, and then also just lack of understanding of the importance of having care. Some women, they'll go get ultrasounds to see the gender of the baby, but not to go for the anatomy or things like that. There's just lack of knowledge of the importance of having routine obstetric care.
So Georgia ranks towards the bottom on both of those metrics, both maternal mortality and infant mortality. And it goes beyond problems such as access to health care. We do have a serious issue with access. Over half the counties in the state of Georgia don't have a practicing OBGYN in those areas. And so women have to travel long distances to get prenatal care. They run into many barriers, having to take time off of work, find childcare, have transportation. They have to wait at the doctor's office. And so a lot of women will skip some of those appointments. And so some of the early intervention that we could do for women during pregnancy is not made available to them.